Hello and thank you for tuning in. Mitral regurgitation can be mild, moderate, or severe, and symptoms can be significant, affecting daily function. In this video, I talk about the anatomy of the mitral valve, highlight the mechanisms of mitral regurgitation, and assess a case of mitral regurgitation, highlighting the PISA method. So, the mitral valve has a complex anatomy, and in 3D TEE, we orient ourselves in the surgeon's view where the aortic valve is anterior to the mitral valve. We appreciate the valve's anterior and posterior leaflets, with each housing three segments, A1, A2, A3, and P1, P2, P3. The whole structure is also saddle-shaped, and in 2D you can appreciate how the valve's appearance changes with changes on the omniplane angle. With this in mind, it is important to identify the mechanism of mitral regurgitation. And one way is by dividing it into primary or secondary, where primary means there is something wrong with the valve itself, and secondary means the regurgitation is due to another pathology, like left ventricular dilation. Carpentier's classification is another way, and it bases the mechanism on how the leaflets move. Now, the ASE guidelines discuss the qualitative, semi-quantitative, and quantitative approaches to assessing regurgitation. Each of these methods has its own advantages and pitfalls, so the algorithm incorporates a lot of these. Since quantitative approaches are the preferred approach to assessment, I'll focus on the PISA method because it is the most used method of quantifying regurgitation. But keep in mind, it is not perfect. So, in this case, the LV ejection fraction is severely reduced. Color Doppler shows regurgitation during the entirety of systole, which is appreciated in color and mode. The mitral valve appears normal, however limited as the anterior and posterior leaflets fail to come together, particularly in the A2 and P2 region. So this is secondary MR with a Carpentier class of 3. Now, we zoom in and adjust the color Doppler baseline in the direction of the regurgitating jet. The Ailing's velocity here is 24.5 centimeters per second, and the PISA radius is measured at 0.7 centimeters. With the continuous wave Doppler function, we get the MRVTI, and here the EROA is measured at 0.18 centimeters squared, and regurgitative volume is 19 mLs. Referencing the stroke volume, 49 mLs, I calculate the regurgitant fraction, which is 38%. I measured the vena contracta to be 0.67 centimeters and find systolic flow reversal in 2 of the pulmonary veins. So the valve was ultimately replaced and no evidence of regurgitation, leak, or stenosis was observed. Thank you for your attention. I hope you found this video helpful. Please like it, leave a comment or question, and share the video where you find it appropriate. See you next time.